So the next technique we're going to do is the Cibulka slam, or the lumbopelvic manipulation. This is indicated for patellofemoral syndrome at the knee here. Some of the clinical prediction rules that we can use to assess whether or not this manipulation will be good for our patient is the side-to-side difference in hip internal rotation is greater than 14 degrees. We have ankle dorsiflexion greater than 16 degrees with the knee flexed. The navicular drop is greater than 3 millimeters. No self-reported stiffness when the patient is sitting for greater than 20 minutes. And squatting is the most painful activity. So what we're going to do here is have the patient lying here. We want to make sure that they're scooted a little bit more on that side of the table, so we're going to move over just a tad. Then what we want to do is bring their hips back over. You're sticking the table. There we go. To kind of get a V-shaped, there you go, position with the hip closest to you. Then from here, what we can also do is have our patients cross their legs to kind of hold that position. Then have our patients interlock their fingers, bring it back behind their head like so, perfect. Then we want to grab our patient here, roll them up, and then we can interlace our arm through the hole here. And then we can put our hand on the side of the table to kind of help create a fulcrum point there. Then we can place our hand here at the iliac crest. Want to make sure that our patient is still within that C position, or the C or V position that we started with. And then from here, what we want to do is have our patient take a deep breath in and out. We're going to follow them down and then apply that quick thrust at the end of that restriction there. And if the patient had 3 of those clinical prediction rules listed earlier, they had very good outcome measures and decreased pain. And if they either had 4 or 5 of those outcome measures, they're pretty much healed. So we can fix everybody with this pretty much. But anyways, like I said, this is indicated for patellofemoral pain at the knee, even though we're treating the low back.